For years, the LGBTQ+ community has fought for space within American society, from the right to gay marriage to anti-discrimination policies in the workplace. However, the nation still seems to be at odds over the right to equitable health care. A lot of rhetoric that we've seen lately as a nation has centered around health rights of transgender or gender nonconforming patients. And while important, this isn't the first conversation that sprouted up when we look at American healthcare and the LGBTQ+ community. Did you know that until 1973, around 50 years ago, homosexuality was actually considered a sickness or mental illness by the American Psychiatric Association? And during the 1981 HIV/AIDS epidemic, LGBTQ+ folks faced heavy stigma and prejudice, with the disease being referred to as gay cancer. But it also led to a wave of queer activism, since US officials were making little movement to prevent or research the disease, which heavily impacted Black and Latinx gay men, as well as transgender women. All this to say, the fight for equitable, affirming healthcare continues to knock on America's doorstep, and we wanted to find out what that looks like for West Michigan. So we partnered with the Grand Rapids Pride Center and Corewell Health System to explore today's health landscape, where it's at and where it's working to go.
West Michigan is home to a robust set of healthcare options. It holds the state's largest federally qualified health center, and after a recent merger, also plays host to the state's largest health system. In the city of Grand Rapids, the strip dubbed Medical Mile is renowned as a world-class healthcare destination. But providers say these may not be the only reasons patients are flocking to the area.
Definitely have had people moving from other states to Michigan because of certain laws that are in those states.
As the nation continues to grapple with policies surrounding LGBTQ+ protections, healthcare has taken center stage, with at least 19 states having laws restricting gender-affirming care, and at least 7 states allowing doctors to turn away LGBTQ+ patients altogether. Healthcare providers and advocates say these barriers can increase the likelihood of anxiety, depression, and suicidal ideation in this population, specifically transgender, non-binary patients.
We get calls every day of the week from people from Texas and Florida in particular, calling to say, we're in the process of moving up to Michigan and want to know about XYZ. A lot of it really is like, okay, so medical care there, therapists there, because we're uprooting specifically for safety, but specifically for medical care. Like, my kid needs to be able to get on hormones. There's doctors there that are going to prescribe hormones for my kid, right?
While Michigan isn't currently designated as a refuge or shield law state protecting access to health care, it is widely considered a safe place to land for gender-affirming treatment. So
these are just some pieces of flair, I like to call them, but this is kind of a badge buddy that is rainbow themed for the LGBTQIA community. Pride flag, it has my pronouns on it below it. Another kind of button here that also indicates that as well.
Dr. Christopher Palazzo is a board-certified physician with Corewell Health. He specializes in family medicine and is identified as an LGBTQIA+ safe and affirming provider.
Affirming care starts before you even get into the office. It starts at the front door. There's a lot of percentages out there that you can find of specifically, trans patients who have been rejected care or harassed in a medical environment, which leads to barriers, it leads to walls. These patients are afraid to even seek emergency care because they're afraid that they're not going to be treated properly.
One type into a Google search will show gender-affirming care rights have been at the center of discussion in 2023, particularly in relation to the treatment of minors. While Palazzo does work with puberty blockers and gender-affirming hormones, he says this realm of service or procedure isn't the only issue on the table when it comes to equitable healthcare. Just feeling comfortable or welcome in health spaces can be particularly difficult for LGBTQ+ patients.
So, especially with things like pronouns, cis patients don't ever have to think about being misgendered on a day-to-day basis. So that's something that's super important for getting a dialogue with a patient and getting their trust is getting the pronouns that they use right. A lot of times in healthcare over the years, a lot of our minorities, marginalized communities have been wronged. And there's a fear that that's something that's going to continue to happen, and that's a barrier to care for a lot of patients in the LGBTQIA community.
These concerns and lack of trust in health systems are sentiments the Grand Rapids Pride Center knows all too well.
Two-spirit LGBTQ+ folks do have really high needs for mental health support because discrimination and the stress and impacts of that are really high. The other side of that, of course, is finding an affirming therapist, finding someone who isn't going to blame your identity for why you have mental health concerns or stress.
Amina Shakur works as an accessibility and healthcare coordinator. One of their many jobs is to bridge the gap between the center's members and safe, reliable care, whether it relates to physical or mental health.
Having an affirming therapist makes the difference between whether or not that therapy is actually good and useful and helpful to you, or if it is doing further harm to you. And far too often, it is doing further harm.
The center's therapy assistant program connects LGBTQ+ community members with vetted, affirming care providers. It's also designed to ensure individuals can access these professionals by breaking down some of the financial barrier.
Two-spirit LGBTQ+ folks often do not have the same financial access as wider community. And of course, we know that in Grand Rapids, there's a lot of financial disparity in general. So LGBTQ folks often run into issues where they do have insurance, but the copay is going to be a barrier. You know, if you have to pay $25 or $50 every time you see your therapist, you know, you're being like, yep, can't go this week because need to put that into the gas tank. So we're able to pay for a certain amount of sessions.
While Shakur says there are affirming care providers in the area, they add the pool of options isn't very expansive, especially when it relates to people of color and other intersecting identities.
It's really hard, and it's disappointing to say that Grand Rapids does not have a lot to choose from. When it comes to overlapping identities, it is so difficult. Excuse me, I am a multiplicity of things. So when I come into your ER, I experience Islamophobia and racial misidentification and racism and ableism and homophobia, biphobia, and transphobia, all at the same time.
Research shows discrimination in healthcare settings is widely experienced by the queer community, and a 2019 study in the National Library of Medicine found more than 1 in 6 LGBTQ+ adults reported avoiding healthcare due to anticipation of discriminatory practices. Whether it's individuals putting off doctor's appointments or being unable to access care, Palazzo says patients face dire effects.
You know, some of the statistics say that especially trans community, 40% have thought about or attempted suicide in their lifetimes, and that's huge, you know, compared to the general population, especially in a marginalized community. That's a huge number. So, you know, it is truly life or death that these patients get affirming care, that, you know, they feel valued, they feel heard, and their needs get met.
He says Corewell Health has committed to a vision of quality healthcare for all. The group, which merged industry giants Spectrum Health and Beaumont Health, is now the largest health system in Michigan, serving more than 1.3 million patients. That's something Palazzo says can carry weight in this conversation.
So Corewell believes in equity of care for all people, and our big goal right now is to make that accessible and available no matter where you receive care through Corewell Health. So if it's in the hospital, if it's in a specialty clinic, if it's in a primary care office, You know, it doesn't matter, it doesn't have to be one clinic that focuses on LGBTQIA healthcare. It should be something that's your clinic that you go to regularly. So that's really the stance right now that we're really working towards, is to, implement that and make sure everybody's on the same page with that mission.
So how does every employee get on the same page, particularly in a system like Corewell, which boasts more than 60,000 team members at hospitals across the state?
So at Corewell, we're doing modules that currently are voluntary, but a lot of people have done them. And on our website, we designate physicians, providers that are safe and affirming if they've completed all the modules. And if a full office, everybody in the office from the front desk to clinical staff takes these modules, then you're deemed a safe and affirming clinic. We have improvement teams that work specifically on LGBTQIA care that meet monthly or every couple times a month that focus on issues that are pertinent to roll out through the system. We've also rolled out an LGBTQIA patient navigator, which is a position that is able to find resources or care that patients need.
Palazzo admits Corewell is still growing in its approach to equitable healthcare, saying there's always hurdles to change. He cites the discomfort some physicians may feel about adopting new practices, the learning curve of implementation, and the frequently changing political policies.
I think that there's a lot of work still to do, to make things more cohesive, and that's something that we work every day in some of the committees that Corewell has and I'm a part of. The biggest thing is this care to provide a safe space for patients. It's very rewarding. It's something that you can see smiles on faces of patients who initially were timid and shy, afraid to come in to seek health care, and that's the most rewarding part, and that's why we do what we do.
When asked about the long-term blueprint for equitable healthcare, Palazzo says it's about centering the patient, addressing barriers, needs, and culturally responsive care.
The future is kind of unknown politically as far as, what that's going to look like for this care, but I think, this is a question about medical necessity. It's not a question about politics, and it should never be.